Welcome to part 1 of our comprehensive 4-part series, Indirect Tooth-Coloured Restorations, Science, Art and Technology in Modern Conservative Dentistry. In this first 10-minute session, we lay the essential groundwork by exploring what are indirect tooth-colored restorations, understanding the core philosophy, preserving tooth structure while achieving superior aesthetics and function. Deep dive into the first 3 key types: porcelain veneers, indications, advantages, minimal prep, stain resistance, stainless longevity and clinical procedure, inlays and onlays. The ideal middle ground solution for moderate damage, when to choose them, their benefits and limitations. All ceramic crowns restoring severely compromised teeth, indications, advantages for protection and aesthetics, and procedural steps. Critical success factors: how material selection, clinical technique, and patient compliance determine the longevity of your restorations. In modern restorative dentistry, the goal is not just to repair teeth, but to do so while preserving natural structure and achieving outstanding aesthetic and functional results. Indirect restorations fabricated outside the mouth in a dental lab are central to this approach. Over the next 10 minutes, we'll explore the fundamentals, types, and key considerations for these advanced treatments. This series is designed for dental students and practitioners seeking to master the latest evidence-based approaches in conservative aesthetic dentistry, blending science, clinical skill, and cutting-edge technology. Let's start with the basics. Unlike direct restorations like fillings, which are placed and shaped directly in your mouth, indirect restorations are custom made in a laboratory. This allows for superior precision, fit, and aesthetics. They are crafted from advanced materials such as porcelain, composite resin, and zirconia. These materials are chosen for their ability to mimic natural teeth in color, translucency, and strength. The most common types include porcelain veneers, inlays and onlays, crowns, bridges, all ceramic and all porcelain restorations. Each type serves a specific purpose, which we'll now examine in detail. First, porcelain veneers. These are thin, custom-made shells bonded to the front surface of teeth. Indications: they are ideal for treating severe tooth discoloration, chipped or worn teeth, gaps and spacing issues, mildly misaligned teeth, enamel defects. Advantages: they perfectly mimic the light reflecting properties of natural enamel, highly resistant to staining, require minimal tooth reduction, typically only 0.5 to 0.7 cm of enamel. With proper care, they can last 10 to 15 years or longer. Procedure: it's a simple process: initial evaluation and impression digital scan, minimal enamel removal, lab fabrication while you wear a temporary veneer, final bonding with a strong adhesive cured with a spatial light. Next, inlays and onlays. Think of these as a middle ground between a filling and a crown. Indications: they are used for moderate tooth decay, fractured or cracked teeth, worn teeth, replacing large failing old fillings. Advantages: preserve more healthy tooth structure than a crown. Made from strong tooth-colored materials like porcelain, highly precise thanks to lab fabrication. Limitations: more expensive than direct fillings. Require 2 visits, can fracture under extreme biting force. Still require some removal of healthy tooth structure. Procedure: similar to veneers, remove decay and prepare the tooth. Take an impression or digital scan. Place a temporary filling. Bond the final lab-made restoration in place. Crowns or caps are used when a tooth is significantly compromised. Indications: severe decay, fractured teeth, teeth that have undergone root canal treatment, severely worn teeth for cosmetic enhancement. Advantages: provide excellent protection and longevity for weakened teeth. Fully restore chewing function. Custom made to match the shape, size and color of your natural teeth. Limitations: more expensive than simpler procedures. Require significant removal of tooth structure. Potential for complications like decay under the crown if oral hygiene is poor. Procedure: prepare the tooth by removing decay and shaping it. Take an impression, place a temporary crown, cement or bond the final crown permanently. As we conclude part 1, remember that the success of any indirect restoration depends on 3 key factors: material selection, clinical technique, patient factors like oral hygiene and habits. In our next parts, we will cover bridges, all ceramic systems, survival rates, common reasons for failure, strategies to enhance longevity, and the revolutionary impact of technology like CAD/CAM and 3D printing. We'll also discuss real-world survival rates. For example, porcelain veneers and crowns boast a 90-95% success rate over 10 years. This has been part 1 of our series on indirect tooth-colored restorations. I am Dr. Maher Mahdi Salih Alrubayee, and I look forward to continuing this journey with you in part 2. Thank you for your attention.